Okay, so I'm going to take you through a very simple example, a very simple exercise to give you an idea how this works. And actually you'll get an idea how simple actually the rapid assessment protocol is if you have the right data, that is. So basically the biggest part of my work was collecting the data, and the calculation exercise itself did not take so much time. Collecting the data and also agreeing on the scenario and the parameters took a lot more time. So basically we have information that we already have, or information or parameters that we already decided at one hand, and on the other hand the information that we require and we need to decide to make the projection and to make the calculation. So these are what we typically would have at the beginning of the calculation. We would have the types of benefits or amount of benefit that we will give. We will have the number of people targeted. That has to be clear, or the group that is targeted, that has to be clear in the beginning. And then for programs that are already existing, we need to know the current coverage among the target population. But then we need more information than that. We need first the amount of benefit in the following years. So we have information of the amount we want to give now and how much would we give it next year and the year after. There are some options. Do we use, as I've explained earlier, inflation for the increase of benefit, or do we use wage increase, for instance, or do we use other types of parameters? The second one is the number of target group in the following years. Do we use population growth? For instance, earlier I explained that to project the number of disabled people, assuming the same situation exists in the country, then we use population growth in general. Or do we have specific specific growth of specific population? For instance, people living with HIV. It's not as simple as assuming that they will grow the same, the number of them will grow the same. So for HIV scenarios, for instance, we got some information from UNAIDS and the National HIV Commission, because they have done their own projection for number of people living with HIV and number of new infections, number of newborns with HIV, and so on and so forth. So the projection of the target group population is independent of the general population. Then we need to think of the coverage among target group in the following years, both for new programs and for already existing program if you want to extend the program. How big is the take-up rate? This consideration takes into account not only government willingness to pay, for instance, but also whether the facility, the infrastructure allows more people to register to the program. If it's healthcare, would the supply side be more available? If it's HIV testing, would the existing healthcare be able to cater for that many number of people, and so on. Then the last part is how much will it cost in the following years? Because we know how much it costs now, but we also know, given the additional number of people, given the take-up rate, given the increase of benefit, how much will it cost? We will know how much it costs in terms of the currency, how many dollars, how many rupiah, but we also want to know how much is it in terms of percent of GDP and in terms of current government spending. So if I give you an idea, an example here, again I give you a simple example. Say we want to have a minimum pension for people with severe disability. Now we have a column and then for the following year. These are the information we have. We want the benefit to be 30 USD per month. We want we have existing target group, as many as 200,000 persons. The coverage at the moment is 20%, and the admin cost is 15%. This is a simplified figures, of course. In the actual costing, the number is not as round as this. But basically, these are the decisions that we took. The increase of benefit, we decided to use inflation. And we have already inflation projection, which is 5%, let's say, from 2012 to 2030. Then population growth, as I said, we use general population growth, which is, say, 1.2%. Take-up rate would be 10% a year. Admin cost remains. Then we have the new number. So simply, you have the total benefit on the left-hand side. Basically, the amount of benefit multiplied by 12 in a year, multiplied by the coverage and the population targeted. Then you have the total plus the admin cost, 15% times the total, this is 15% times the 400,000. So, but you don't need to pay attention to the number. Basically, you have the total cost. And then you have the total cost of the following year based on the new figures that we produce. Then you have the next step is you want to see how much it costs in terms of percent of GDP and in terms of percent of government expenditure. Then you have the total cost this year, GDP this year, government expenditure this year. The total cost is as what we have calculated earlier. Then you want to know, you want to see the difference in GDP next year. You have GDP projection. Then the government expenditure next year, you have government expenditure projection. So this is what we have. Cost in percent of GDP is the total amount divided by GDP. So it's 0.00, very small at this for this scheme. And cost in percent of government expenditure. And then you apply the same using the new figure from next year based on projection. So basically, from year 1 to year 2, that's how it works. And from year 2 to year 3, the same thing applied. So you can do it as long as you have the projection data available. If the projection data is available to 2020, you can apply that more or less depending on the data available. For this exercise that we did, we want to have projection up to 2020. But as I will also show you, sometimes the data projection is available to that year. Sometimes it's slightly before. If it's more, then that's fine. But sometimes it's slightly before, and we have to make decisions again whether we want to make our own projection or we just stick to what's available. So, and this is, as I said, the biggest part of my work, collecting the information. First, we have population sheet. You don't have to pay attention to the number because it's too small for you to see anyway. But I can show you here that in Indonesia, luckily we have already a population projection made by the Bureau of Statistics and the Planning Agency. We have it divided by age and sex. We have for each age, for every age up to 75, but 75 and more, they are in one bracket. Or then we can simply make it, if you want to make it 0 to 4, 5 to 9, and so on, because the data is available. What I'm showing you here is the total population, male and female, for each of the age brackets. So the source of data, what I have here is based on population projection that's available nationally. There's a bit of an issue with this data because the projection was made based on the 2005 census, and 2010 we had another census, but the projection has not been done. So this will be updated as we have the new figures. But alternatively, if you don't have national projection data, there's also ILO population projection that maybe Jean-Claude can explain further. But basically, you can make your own projection based on the assumptions provided by the ILO data. Or you have UN population, for instance, which has also population projection. So there are some alternative sources of data, and as much as we can, we want to use national data because we want this to be used also in the end by agencies in the country. So the source of data should also come whenever it's reliable from the national sources. Then we have macroeconomic sheet. I only put here a few, and especially the ones in red, that you just need to pay attention to. It is actually a lot longer than that. For instance, for GDP, we have for the different sectors, and there's a lot more other items there. But for now, let's just focus on these ones. We have inflation. We have GDP at current prices, which will be used to see the amount in percent of GDP. We have poverty line, which is here only the national average poverty line, for instance. And we have other items such as average wage and so on, which we will not be using for now, but you may need it for different costing. To give you an idea of the sources of data and alternative sources of data, for GDP, for instance, the planning agency has a projection. The IMF economic outlook has also a projection of GDP. In the beginning, I used the one from IMF, but then I found out that the planning agency has also recently done this projection. And when I cross-checked, they're actually more or less the same, so it was convenient. For inflation, I use IMF economic outlook. Poverty line, there was no projection available for poverty line. So the option was to make our own projection based on previous trends. So when I use inflation, which may not be accurate for the different contexts, I use inflation, but then I compare it to the previous trends, because we have historical data and projection. When I compare it with the historical data, the increase of poverty line that the government has used, it's actually quite in line with the inflation rate. So for this, inflation rate was applied. For wage, we apply labor productivity and inflation. And we don't show it here, but there's also lines on labor productivity based on GDP and number of workers and so on. So to give you an idea of how you get the data. Sometimes it's available, sometimes you have to make it, sometimes you have to decide which parameter to make your own projection. The next sheet is government operations. It's also actually much longer than this, because there's not only expenditure but also revenue, and there's detailed breakdowns of the items, but for now we need to see the total state expenditure. Here we have total state expenditure. here's the thing. We have information, historical information from 2005 to 2010, based on central government financial report. And then we have projection by the IMF up to 2016. But we need information up to 2020. So, and the projection is only for the total amount, not the breakdown. So what we did is we used the IMF economic outlook projection, and whenever we need to have the breakdown, we break it down based on the trends in the following year. Let's say if transfer to local government is 20%, then for the projection we also apply 20%. Now, from 2017 to 2020, we do not have the projection. So what we could do was only applying the previous projection to those years. So we use the same trend, assuming that everything is moving the same way. So the increase would follow the average increase of the previous years, information from previous years that we have. Now, I will show you the simple scenario that we have. So here's how it looks like. First, you have these basic information in the beginning, just as guideline for all users of the tool. Then you have the population sheet. You see here, if you can see from where you are, you have total population consisting of male and female for the age brackets, male population, female population. And you see that there is years in the past, which is our base as historical data, and there's the projection. As I told you earlier, this is based on the this is not the most updated data, which may change a little bit, but not much when we have the more recent data. Then we have here population for each age group, so from 0 to all the way down 75 plus. So up to 74 you have for each age, and then you have 75 plus. So that's the population sheet. Then we have the eco sheet, consisting of all these information that I've shown you. Then we have government expenditure and revenue here, government operations. So you have revenue, historical data from 2005 to 2010, and then you have projection to 2016, and then projection of the total amount to 2020. Is there any questions so far, or should I just quickly demonstrate one of the scenarios? Can I just go straight to the scenario? Okay. This is very simple. We have scenario 3 for elderly. Universal pension for 55 and older. Here we want to, you see in the first line here, can you see it from where you are? No? I'll try to make it bigger. Is this better? Yeah. Okay, now we have scenario 3. When you want to see your target population, you see here, it's basically the number of population that we have in the population sheet You see here age 26, age 28, age 28, age 26, age 28. Here. So you have this number because it's already provided here, people age 55 and older. Then you have your target population here for each year. Then you want the coverage to be, let's say, this was made last year. You want, let's say, you want to make the coverage 20% in 2012, and then you need to put the benefit amount here, which is the poverty line, and we already have poverty line in the eco sheet, so you simply refer to eco I-22. Then you can already calculate the overall benefit, which is population multiplied by coverage multiplied by the amount of benefit times 12 for a year. And then this is for simplification of the figure divided by 1,000 so that we have the figure in million. There you have already the total amount of benefit. Then you simply apply admin cost, which is 5% times the total benefit. And then you have the total amount here, the total expenditure. And here, when you have the total cost divided by GDP, and underneath you have the total cost divided by government expenditure. And that goes on to the following years. So basically here we made it up to 2020. So quite simple, right? As I said, this is not a proper actuarial calculation, as it is a rapid assessment protocol.